Welcome to the special series of a Healthier Michigan podcast coming to you from the Mackinac Policy Conference, where we've been exploring one of the most pressing challenges facing Michigan today, healthcare affordability. Across this series, we've heard how partnerships across Michigan are working to improve affordability and outcomes, from value-based care to how employers are navigating rising costs while trying to provide coverage, and how community investments are helping address the broader factors that influence health and long-term system costs. In this final episode, we'll bring those perspectives together directly from the conference floor. Rather than a traditional panel discussion, this episode captures a range of voices in real time from across Michigan's healthcare, business, policy, and nonprofit communities. These are people like you and me who are feeling the pressure of rising healthcare costs. The goal is simple: to hear, in their own words, how affordability is being experienced across sectors and where they see real opportunities for solutions through partnership. Ryan Maibach joins us now. He's the CEO and president of Barton Malo. Good to see you.
Good to see you.
How's the conference going?
It's been fantastic.
Yeah.
Always a great opportunity to see so many leaders and voices for moving Michigan forward. So it's been great.
So moving the state forward, all of the regions forward. Talk about your involvement as a company. What are you hearing that makes you optimistic about where we're headed in this, even in the calendar year?
I think a lot of optimism about just continued growth and investment in the state. So we're a construction company, and we like to see that growth and investment. We do it throughout the U.S., but this is home, and of course we have a bias towards our hometown, and so we're excited. And the thing that's also encouraging is the diversity of the investment. So it's wide-ranging from traditional industries to new endeavors and growth in energy. So it's very exciting.
So affordability is a big word that's being bantied around, right, in all sectors, but especially in the healthcare sector.
Certainly.
Talk about that from a large company perspective. We've had a view of small business in Michigan and how that's affecting them, but talk about your business.
Yeah, I think we look at all of what we do for our team members holistically, and I think we want to create a positive experience. Yeah. And a big part of that is healthy living and access to healthcare. And we all engage in the healthcare system either at different ages or different moments in time in a variety of different ways. And so making sure that it's accessible and affordable, because oftentimes if it's unexpected, then you have to be making choices about investing in your healthcare or investing in other things. And all fitting back into growth. The more affordable healthcare can be, the more economic opportunity there is and use of your dollars in other places.
And team members, it's important to look at retention, right? Because everybody's looking at maybe that whole package of benefits, salary, et cetera. But it's also important to be attractive to talent. Not only for your company, but to the state in general, right?
100%. And ultimately, I mean, hey, we know we all do better when we're healthy. And so you also just want people to be able to engage in preventative care, to be able to make sure that you're doing the right things.
Is that big for your company, this idea of getting ahead of the curve instead of waiting until you're sick?
Absolutely. And I think also born from personal experience. I mean, we joked before we were getting going, a few more gray hairs today than there were a few years ago. And you realize the value of that preventative care and being proactive. We all have to have a measure of ownership and responsibility for our own care, but it's got to fit into a system and a construct that's accessible and affordable.
So you have a position, again, that's unique, but as a business, your position to influence is there as well. What about influencing policymakers and hospital systems, insurers? What do you see as your role there?
Well, first I would say we have terrific insight into by a lot of our clients, our healthcare systems, both locally as well as nationally. And we're fortunate that there are some tremendous leaders that often people may not understand, whether it's, again, Blue Cross or leadership of Henry Ford or Corewell. We have some great systems that are really wrestling with that affordability issue. It's been a topic up here quite a bit. And so part of that too is helping to create facilities that can improve the efficiency of of healthcare and how it's conveyed and delivered. And so some of the newer technologies that we are privy to as we construct new buildings are remarkable. And we often comment as we're creating the spaces of the lives that are going to be impacted as a result of the work that we do in the space. And so it's it's exciting to embrace and see some of the what used to be far more invasive that today is much more routine in a healthcare environment. And again, the new technologies that are being installed today are very much part and parcel to being.
And we're hearing a lot more, not scary stuff, but a lot more about AI assisting in even streamlining costs, which is a fabulous idea.
And I think going back to being proactive. I look at my own family's utilization of AI in either diagnosing or trying to better understand and being able to take a look at one of the really wonderful aspects of humanity is that we're all entirely unique, and our healthcare circumstance is entirely unique. Being able to leverage the power of AI to be able to understand our blood work or whatever testing results we get back, we're all going to be better consumers as a result as well.
So from your position, if you could get a number of stakeholders, they don't all have to be big shooters, but a number of stakeholders at a table to look at this affordability crisis, maybe is a good way to put it, in our state for healthcare, who would you bring to the table?
Well, I think to really tackle it, we have to look a lot broader than just the traditional constituents of the healthcare systems or insurers, because really in so many ways, I think Bob Riney has done a terrific job of highlighting that as the chair, this is the chair of the conference, that we have a state, a reality that is increasing in age. Our average age is increasing, and that creates some unique strains on healthcare. So I think to really meaningfully tackle it in a sustained manner, we got to look at many other maybe non-traditional things. You wouldn't think about population growth as a key to healthcare cost reduction, but it really is. And so really to make meaningful progress, I think we need to make progress on a number of other economic factors as well.
And that idea of cohabitating even over coffee and in a beautiful place like Mackinac Island, helpful for everybody, all the stakeholders, right?
It is. And I think you come to an environment like this and you realize that there's way more in common than not. And oftentimes it's unfortunate that the marginal differences can be more of the challenge to overcome. So there's a measure of optimism in coming here because you do feel like there's a lot more hope for a better future.
Yeah. Well, Ron, good to see you.
Thank you.
Thanks for
Appreciate
taking time to say hi, and thanks for what your company does in the community too, because there's a lot there that maybe goes unrecognized, but I've been down on the front lines helping, and I know you guys were supporting some of those efforts, so thanks.
Thank you. Appreciate it.
Good to see you. Jamie Westrick is with us. She's the Chief Philanthropy Officer at Michigan Humane Society. It is nice to see you.
Nice to see you.
I was walking right behind you to get in here today, and you got a call, so I didn't have a chance to say hello, but I saw you were walking with purpose. But you don't just walk for yourself at home. You have two pals that help you go for walks. They take you for walks, right?
We do. Yeah. When you think about our healthy lifestyle, it's centered around our pets. Yeah. I always say to them, "Thank you for taking me for a walk. I needed that."
So what do you see from your perspective? And I want to double back to Michigan Humane in particular, but for us, the families with pets, that is part of keeping healthy, even if it's something we don't realize, right?
Oh, totally. For us, my household, we get started and motivated every morning thanks to our two dogs. Yeah. They are on a routine. They know when we wake up, we go for a walk. So they motivate us to start that schedule of the walk for the day, and we end the day the same way.
We have trained our dogs to ring bells. So I'm the one who's trained, right?
Exactly.
I hear the bells go, and I can actually say to her, "Not right now," and then she goes and gets, and bam, she hits them a second time. It's like, I'm telling you, I've got to go now, let's go. So it's good. Michigan Humane is actually encouraging the healthfulness of life, even with a run and walk, right? I mean, you're doing things that are encouraging people to be involved, and to be involved with Michigan Humane, but also to think about this as an activity that can help us all.
For sure. I take my own pets, for example. They truly have impacted our family's health and lifestyle. At the same time, we know research shows by having a pet, by having a dog, you are more active, right? They lower your blood pressure. They improve your companionship and your overall health and wellness from an emotional standpoint. So there is amazing value in having a pet. And for us at Michigan Humane, it was really important to think about how do we bring our community together in celebrating our pets and celebrating that human-animal bond.
Yeah.
And so we just launched our first tailgate. We hosted it in May at Michigan Central Station in Roosevelt Park there in Corktown. And we brought families together to run with their dogs with our 5K, with our Mutt March. They could walk, and they could also adopt with our Meet Your Best Friend. So if you didn't come with a pet or you wanted to add one, you could join us in adopting that day. And so we're looking forward to being back there again next year.
When you think about healthcare costs, you're leading a busy family. What is it that strikes you about healthcare costs and what's happening in our state? And you see it.
Well, I think first and foremost, I'm fortunate to have healthcare, right? At Michigan Humane, we offer wonderful benefits to our employees. And so starting at that point, I recognize that I have that privilege. But at the same time, I've really taken, I have 3 growing boys, my husband and I, we're very proactive in our own health, right? And so for me, it's about taking health into our own hands. Mm-hmm. I think walking is critical every day. If you get a dog, that helps.
Yeah.
And at the same time, we work out. We also, I meal plan. So healthy eating is really important. Great sleep is really important, and having that routine. So for me, it's really about taking health into your own hands and choosing to play the long game versus the short game when it comes to the alternative.
But that nature of being proactive in your family's life, you've got to start something to begin it, right? I mean, some people think, well, I'm too far into my family's life, I can't start a new habit, or I can't begin getting healthy now. There's never a time that it's too late, right?
It takes work, right? It takes discipline, but if you haven't done anything in terms of choosing healthy, then start somewhere is what I always say, right? I follow a lot of Pinterest recipes, talk to family and friends. You eat somebody's healthy dish and you're like, oh, I like that. It's just about incorporating that. Personally, I started seeing a nutritionist through my primary care office, and that was huge. Those are resources that are available to people with a simple copay if they want to choose to eat differently.
That's great.
And be healthy.
And that's being proactive as well, right? Because you're getting ahead of the
Right.
curve where down the road you're not going to need health care of some kind, maybe.
Right. And that's my hope, right? And I think that's the challenge, right, is our healthcare system is compensated based on prescriptions, needs. How can we avoid that and choose otherwise? And that's what I was happy about, is being able to go to my primary care physician and seek out that proactive choice.
Talk about what you see through Michigan Humane Eyes as well, this connection we have to our animals. I'm always astounded that we see studies that say people of all demographic age are lonely, right?
Right.
And yet when I get a pet in my family's life, they become a member of the family, and that connection you were talking about, how instant do you see that happen in the adoption process? Where
It happens pretty quickly.
Yeah.
I think there's something magical that happens when a family chooses a pet and a pet chooses a family.
Yeah.
And that bond, it develops very quickly. And at the same time, you look at the lifestyles, and in my own home, I have 3 boys, and I know every morning when they wake up, they're looking for their dogs.
Yeah.
Right? Their dogs are looking for them. And then when they get home from school, they're seeking out their dogs. And there's almost this like stress reliever that happens that you can visually see when you pet an animal and you just kind of hold on to them and you let things go from the day. I see it in my own children. It's pretty incredible.
Michigan Humane is also launching a new campaign, right, for an endowment. And why would I have assumed that you've had a campaign like this for such a long time?
We've been fortunate to be around since 1877,
Wow.
serving our community, serving our animals and our families. And we'll be celebrating 150 years next year.
Good for you.
And to think that we've never had an endowment, really what I consider that safety net for any organization to sustain itself for the long term. I'm very proud that we are launching one, that we're setting up the organization and our mission for success, and very proud of the supporters who've joined us at this point. We've committed $28 million to date towards our $50 million goal.
Wow.
And I see a path forward to hitting that $50 million, but it's because of the role that pets play in our lives, the importance that they have in people and in community. And when we think about building healthy communities and safe neighborhoods and really a vibrant economy, it's a big role that they play.
Well, it's always great to see you.
Good to see you too.
And the next event this calendar year would be what with Michigan Humane?
Oh my goodness, we have our Perfect Bow Wow Brunch coming back Sunday, October 11th at Eastern Market. We'll be back in Sheds 5 and 3 and raising dollars to support our mission, all going back to serve Southeast Michigan.
Beautiful. Jamie, nice to see you.
Nice
Thanks.
to see you too.
Take
Thank you.
Dr. Bernard Costello is with us now. He's Senior Vice President for Health Affairs at Wayne State University. Great to see you.
Great to see you too. Thanks for having me.
Oh, thanks for coming over to help us. What a great couple of days here we're having, maybe the whole time this week.
Amazing. It's my first time at the Mackinac Policy Conference. I'm a new Michigander, and it's been great.
Well, that's awesome. So talk about affordability. It's a word we keep hearing here, but why healthcare affordability is such an important issue for Michigan's future overall?
Yeah, I think it really relates to some of the things that Bob Riney was saying at the opening of the conference yesterday. It affects our competitiveness, and in just about every realm that you can think of. So it affects how employers recruit talent because everybody wants to make great healthcare. It affects how we treat our communities and how we engage in our groups, not just in an urban center where we are right in the middle of Detroit and Midtown, but all over Michigan and rural areas too. There's a lot that goes into that process. It's 19% of GDP, healthcare in general for the whole country. So it's a really important thing to get right in Michigan. For us to do this and get some of those numbers up that Bob and the crew mentioned yesterday for the state, we need to get this right.
So what barriers are people facing in your view when it comes to healthcare and the systems in general in Michigan?
Yeah, it's interesting. I think the United States, the way that it's built, its healthcare system focuses on picking up the pieces after things go wrong. Patient gets sick, they go to the hospital, we can treat them very, very well in the ICU or with complicated care in the emergency room. It's very expensive. Premiums and the care are so far downstream in the process. We need to go upstream and deal with the preventive care issues. I'm sure people have been saying that for a long time, but this is about access to care. It's about transportation to get the care. It's about understanding and trusting in the care, working with the community. All these things are upstream from that process where we spend all of this treasure right now.
Well, you talked a little bit about transportation, housing, food insecurity. A lot of these issues, even I remember I had a wellness check and they were asking me, are you food secure? Even when I checked in on my chart, are you food secure? Or do you feel like you have tripping hazards? All those kinds of things. You don't think of the import of that up front, but this effective language, questions we're being asked can affect long-term health outcomes, right?
Absolutely. It's some of the most important things that we do. It's not enough to just have access to food, for example, or even have money to get food, which there's a lot of issue there too. It's about making good choices in food, for example. And with respect to the transportation issue, Bob and the crew mentioned that yesterday too. We're the mobility state, and we can't seem to come up with new models to really have this be effective, not just for the UP and this island, for example, but all over Michigan, areas that are right around Detroit, for people to access care, get screening, do the things that they need to do that would drive those costs down so that we're not paying for very expensive care on the back end when things go sideways for patients.
We've had the conversation with community organizations and clinics. What role do you see them playing, and what kind of impact from your perspective do you think they have on healthcare?
Yeah, critical and undervalued role. So one of the things I learned coming from Western Pennsylvania, I was at the University of Pittsburgh and the University of Pittsburgh Medical Center for 25 years, was that you could spend tens of millions of dollars on community engagement centers and not get the return on investment that you really needed. Why? Because the trust of the healthcare systems, the various organizations, even health plans, if it's not there, you have a hard time moving the needle on getting people the care they need and developing that trust. Community organizations and the trust that's been built at a place like Wayne State since 1868, we have the trust in the community. We're the gap building agency of good to make that happen. And we do that with our clinicians, we do that with our students, we teach them the best way to do that in those environments. And having that trust for decades, which you can't buy, that's something you have to develop in partnership. Those are really, really critical ways to solve these problems. Again, upstream, it's through churches, community organizations of all kinds, and those kinds of mechanisms where you trust your neighbor, you trust your friend, you trust your church grower when they tell you, like, you should really get that screening. Let me help you get to your appointment, whatever it may be.
And some of the partnerships that you're talking about between healthcare organizations and community groups have real impact. And trust is an interesting thing, because if it's a local neighborhood person who's serving their local neighborhood, there's a connection.
Right. Well, and I think that's where it starts, right? As they say, particularly up here, maybe all politics are local. When you think about systems, though, and if you want to think about an insurance product that's going to help serve a lot of people, integrated with a healthcare system and what it's going to do, you have to spread that trust out widely, right? Because we don't need to just solve this in the urban settings, we need to solve it across the entire network. That's Henry Ford's full network, it's Corewell, it's McLaren, it's Michigan Health, Trinity, the other partners. We need these mechanisms embedded within the systems and with the payers in partnership. We all need to take responsibility for that. It's a collaborative effort. Again, just like the beginning of this conference, we got some things on fire. If we work together to solve them, we can do that.
So it would seem that public and private partnership is a thing. Are you encouraged that we're seeing the folks putting down those walls of silos and working together because they realize what has to happen?
Yeah, this sentiment that our troubles, our critical crisis time period is a time where we can really lean into these opportunities. I think it's something really important for us to consider. I love the message of this conference being that, sure, things are on fire, it's time to sort of address it, let's look at the data. This is the way that you do that. Those partnerships, I think they're critical to making this happen, particularly for Michigan competitiveness. Again, it's not just about health, it's about the state and what we can really do business-wise. All businesses need good health and they need good talent, and people want good health in that process too.
Well, Doctor, nice to meet you. Good luck with your new place of home.
Yeah, thanks. Appreciate it. Yeah, very nice to meet you guys.
Thank you. Carla Walker-Miller is CEO and founder of Walker-Miller Energy Services with us. It is so great to see you. Thanks for joining us.
Great to be here. Thanks for inviting me.
What a beautiful day to have this setting, huh?
Absolutely.
Yeah.
Absolutely.
Just thinking about the health and wellness of seeing sunshine on Mackinac Island, having a big porch, that alone brings people together, right?
It really does. Beautiful weather for a change, too.
Yeah, it is good. So when you look at what is on the top of mind of a lot of people, rising healthcare costs affecting the way businesses are thinking about everything, right? About growth, hiring, employing, and investment. What are you hearing at this conference? What are you seeing back at home?
We're all hearing and seeing the same thing, rising costs and unpredictability. It almost feels like the only thing we can predict for sure is that the costs are going to continue to rise. So that sense of what do we need to do all year to prepare for the inevitability of that cost increase is it's stressful.
And it's not only perhaps encouraging some to leave the state, but then let's focus more on trying to attract talent to the state of Michigan. How do you think it's affecting that?
I think it affects everything, but we have to push through. We have to figure it out and keep moving, no matter what the energy environment, the healthcare environment, no matter what environment. As business leaders, we have to figure it out and push through.
So we all know about rising costs, and we all know about inflation. Some would even call some of it fake inflation, right? Once somebody got their prices up, they kind of kept them there.
Absolutely.
Maybe. But regardless of whether it's authentic or not, this idea of rising costs and wages not keeping up with the rising cost of healthcare. So that differential, you're making a living, but yet you're being stressed out because of costs. Huh?
Absolutely. And individuals are experiencing that, but so are companies. One of the things we promise our team members is that as the company does better, every single person will do better, right?
Yeah.
And as the company does better, if costs continue to rise, it makes it tougher for us to pass even the revenue growth on to our team members if it doesn't come with profit growth. So we can literally grow revenue and still not be able to do much better for our team members. And that is the part, our commitment to stewardship is it's harder to realize in the face of rising costs.
So what role do you see business playing? That's a great example, right, of a revenue sharing plan.
Absolutely.
But participating in that plan and any others that come to top of mind for you about creating these affordability solutions so that if I am able to share in revenue, man, what a great potential that is. But if there's no extra money, I can't share in it.
That's right. And so, and it is interesting because healthcare is that issue that everyone cares about. Even people that don't necessarily receive their health care from our company because they have a spouse or a significant other that gets health care, so they still watch so that they can balance. You know, if our health care gets better, they jump over to us, right?
Sure.
So it really does affect everyone. And one of the most interesting things that my team is most concerned about is probably 4 years ago, I said, I would love to provide free health care. I would love, as a company, to be able to say free healthcare. And so we're working to go do a little bit more every year, but now we're spending more, but we're not necessarily increasing the benefits for our team members.
Yeah.
So I'm personally stressed because I want to continue to evolve and increase the share of what the company pays versus what the team members pay, not just absorbing the cost increases.
Well, I have to tell you now, I don't know how many leaders are going to admit that they're trying to do so much better for their employees when it comes to revenue sharing or paying for the cost of healthcare. But what a strategy you've employed to try to help with this idea of affordability of healthcare to your workers and their families.
Oh, absolutely. And when we talk about retention, but one of our core values is stewardship. And how, what better way could we take care of our team members than to make sure that they're not stressed out about the cost of healthcare?
And stress alone can lead to other issues than healthcare, right? I mean, if that's the life you're living.
Bad.
Yeah.
Stress leads to everything bad.
So finally, as you look toward the future of Michigan, this important issue for us, because I know we're hearing it from all sectors, what do you see in terms of optimism?
I'm optimistic. This is really the Wild Wild West. This is the equivalent of the Industrial Revolution, when there are so many issues and so many changes in technology that we can create the future we want to see. So I can't tell you how optimistic I am, and I really want my fellow business leaders to stop leading from a position of fear and dearth, but the abundance of opportunity is it's going to help everyone. It has the opportunity to serve everyone.
Well, it sure is great to meet you, and I'm so happy we had a chance to chat.
Thank you, Chuck.
Lina Hourani-Harajli is with us. She's CEO of Access, Arab Community Center for Economic and Social Services. It is so great to see you again.
It's a pleasure to always see you.
Yeah, thanks so much.
Thank you.
So are you enjoying the conference?
It's been a wonderful conference. Honestly, we've met so many wonderful people. Always see old friends and make new ones.
Yeah, well, I guess we can say we're old friends. It's
Definitely.
more than just going back minutes, right?
Absolutely.
Yeah. So lots of talk on this conference about affordability, of healthcare, and just it's a political year. I mean, there's a lot of dialogue. But what are you getting a sense of from an affordability standpoint of how the affordability of healthcare in everyday lives is being affected?
Absolutely. So the number of underinsured and uninsured people has obviously increased greatly, and with the tax cuts coming in, it's definitely impacting people so dramatically. What suffers is people's health care, because then they wait. They don't go to the doctor as quickly as they should. They hold off until it's much more serious, or going to the emergency rooms instead of their doctors to save on costs that they can't afford, because gas prices are so high, food costs are so high. And unfortunately, as usual, those communities that are most impacted are those with socioeconomic factors already stacked against them.
Yeah, and it's not simply uninsured, it's also underinsured,
Oh, yes.
right? That people are
Uninsured and
actually working,
underinsured.
but yet they're struggling to pay those bills.
Absolutely, because when your deductible is $5,000 and you're trying to put food on your table, you definitely are thinking about that before you think about your health care.
So how does Access, even with Access, services community-based help? Talk about the importance of that, of helping to be an undergirding for what's going on.
Absolutely. Well, we've prided ourselves for 55 years, and we've definitely, we have 120 programs, 12 locations, Tri-County, and all sorts of services. Our wraparound service approach is always about meeting people where they are. We have our Community Health and Research Center. We have our Youth and Education Department. We have our Workforce and Business Development. And then when it comes to making sure that social services, those basic needs are met, it's where we love to come in. So we opened our own primary care clinic with a sliding fee. You can't pay, we're going to cover you.
Okay.
And making sure that you have access to those services that unfortunately mean, it only increases when your behavioral health and your primary health are not priorities in your home. How are you going to deal with everything else that is coming at you? So we're really happy to be able to offer those services to people.
It's interesting because we heard this from another guest about community care becoming almost more trustworthy, or I guess more connected, because it's a community feel, right? I've got a trusted partner.
Absolutely.
So even though I'm going to seek this care locally, where you may think, well, maybe that's not up to par with care at a hospital, but yet it's that connection one-on-one that's helpful. Yeah.
Well, I mean, for access at least, we serve everybody that walks through our many doors. We're very proud of Arab American led. We've been here. We were started back in 1971 for the community, the immigrant community that was coming for, the Henry Ford automotive jobs. But obviously the community has expanded, geographics and demographics have shifted, which means that 65% of the people who walk through our doors are Arab American, and we're so happy to serve them culturally and linguistically. But in the same breath, we now serve in 27 different languages.
Wow.
So that means that whatever language you speak, we probably have somebody who can serve you in that language. And that has brought a large number of individuals from all communities to come and get care that honestly starts at the heart.
Well, that's great to hear. And, some of the issues that we don't talk maybe enough about, at least often enough, maybe is the way to put this, transportation, food insecurity, right? Getting around. How do you get to even your locations if you have no way for being transported?
So we definitely have lots of transportation options. We've worked hard because that's such a major area of need, so that we are able to provide some transportation, but we also did our one-stop campus, which means that in one location we have 3 different buildings, and you can go to all these different services right there. You stop and, you get one drop-off, you can go and do all of these different appointments, all of these different sign up for services, go get a resume checked, go and see if you have your behavioral health appointment, all on the same campus.
What is it in the past, let's say, year? What innovations are you looking at that you're currently either looking at or you're actually innovating toward?
So we are actually really excited to be building a 51,000 square foot behavioral health and substance use disorder treatment center. We're about 70% done.
Okay.
It's a $30 million project.
Wow.
Something that we are really, really excited to be opening.
Where is it exactly?
Right in Dearborn, in Michigan and Wyoming, right off of 94 freeway, so that it's accessible to all of those, bordering communities and those that are not as close. And definitely really proud to be serving in a way that is going to bring hope and healing to those that need it most.
That's fabulous. Yes. And you're not just standalone as an island. You still seek partnerships, great partnerships with healthcare organizations,
Absolutely.
Blue Cross, right?
Absolutely.
That's important. Talk about that idea.
Absolutely.
Everybody has to talk to each other.
Yes. For us, that's actually been the foundation of why Access has grown so much over these 5 decades, is we know we can't do it alone. And even if we could, it wouldn't be as good for our clients. And so making sure that whether it's Blue Cross Blue Shield, which we have a wonderful relationship with, and so finding ways and partnerships that only increase access to services, to education, making sure community understands. We are a healthcare navigator, which means that the state partners with us to make sure, just because you are able to get health insurance, doesn't mean you understand how to utilize it.
Yeah.
How do you select a doctor? How do you make sure that it's somebody who is going to be able to specialize in the areas that you need? How do you make care more community focused, more heart focused? And so for us, we're really proud to always partner with Blue Cross.
Well, I'm always happy to see you, and it's great to hear what's going on, and congrats on the 70% part of the building.
Yes,
anyway.
We're very excited, excited about the project.
Thanks, Lina.
Definitely. Thank you.
You're welcome.
Thank you so much.
Emily Gerkin Guerrant is here. She's Vice President of Communications for Michigan State University. It is good to see you again.
Good to see you. Thank you.
Bright sunny skies.
Beautiful
it's
day.
Good, right?
Yes.
So you're a busy working mom.
I am.
Think about all you've got to juggle, and we've been talking to a lot of people about healthcare and costs from an employer standpoint, often employee standpoint, but as a mom, as a dad, a granddad, you're thinking of your family's budget too, right?
Yes.
Yeah.
Yes.
How does that work for your family?
Well, I mean, I am a big believer in prevention efforts, right?
Yeah.
Like living a healthy lifestyle, and hope that that's going to pay off in the long run, maybe to prevent some costly or health challenges that are going to come later on. So my husband and I both, we're very active people, working out, playing sports. And as we've raised the kids too, we've liked to have active lifestyles. When we've come up to Mackinac Island, we like to walk or run around the island or bike the island or go out in kayaks and so just having a healthy lifestyle and it's also tied into our mental health, right?
Sure.
Physical activity helping us balance our challenges. So I think that's kind of the key of our philosophy.
Has that philosophy always been part of your family's life even prior to the pandemic, or has it changed from that time?
That's a great question. I think it's always been that way, but maybe we have 2 girls that are in college now. As they were getting ready to go off into college, growing up, they played sports. And I think their physical activity also was just kind of naturally built into playing sports. And so as they were going to go to college and not have these sport teams to be on, if you will, we would have discussions about putting effort into taking care of yourself, your mental health as part of the stress of college, but also the physical health. Do you have a health and wellness building on your campus? Or how much walking can you do in between classes? And talking to them about weaving it in naturally.
But that's so cool, because a lot of us think it's got to be something we plan for, make appointments for, jog around 5 miles for, and yet that non-essential exercise, even walking up the hill, my watch is going off.
Get your heart going.
I got my 10,000 steps yesterday. I'm like, this is, right. And I saw horses. What a country. It was just, I didn't even work hard at it.
Making it natural. One of my daughters found that just walking to all her classes every day, she could get 13,000 steps in. And that was just almost kind of the demand. She doesn't have a car on campus. That's how she gets around.
Yeah. So when you're making your way through the conference this year, a lot of chatter about a lot of things. It's a political year, but also about healthcare, rising costs and the impact there. What else are you hearing? What else are you observing over shoulders that's going on?
I do think the rising cost is a challenge. And although it's not my position at the university to be in charge of the cost, when our leadership team talks, as an employer, that's a concern. Is how are we providing coverage for all of our employees? We have 15,000 employees at Michigan State.
Wow.
We have different unions within there too, so the unions can get engaged in negotiating the type of healthcare coverage that they're for their group that they want. So it's a really important factor. And then, similar to how I talked about my family, our MSU family, promoting health and wellness. How can we have healthy workers and have programs as part of Michigan State that are going to encourage and allow them to be healthy?
Yeah, so, we were talking about this with someone else who was just here. It's not just all about lifespan anymore, it's about health span, right? It's not just how long. We all worry about how long we're going to live. We all do.
We do.
You don't want to talk about it, but it's the thing. But then we also want to be healthy no matter what age we are, from college kids on up, right?
Yeah, absolutely. I maybe because of the age I'm at in life and I start thinking about retirement in the future, keep seeing these articles about you also want to do things that you enjoy. So retiring at an age where you have the energy and the physical health to get out there and do the things you want. And that really made me think more about it. What you're saying, not how long am I going to live, but how do I want to live in the time that I still have?
Well, I just think about it for my own self personally. I'm just going to keep retiring until I get it right.
Oh, are you failing at retirement?
Yes, I am. Okay. I'm tripping forward. It's working out pretty well. Yeah. So when you think about all of this that we talk about with healthcare, all the employees, all that's going on, at the end of the day, some of those costs really come back to us. You talked about your family a lot. Yeah. It really comes back to our family's life and how it impacts our own personal budgets, what we can do, what we can't do. Right?
Absolutely. Yeah. And the chatter around the office or my team that I have young employees just coming out of college who feel invincible, right? And don't maybe think about healthcare or their health.
Yeah.
They think about their mental health. That seems to be more evident to me, that younger generations put a lot of thought into their mental health.
And good for them, right?
Yes.
Yeah.
I don't know how much they're paying attention to their physical health or thinking about that connection. And then I have young moms, right, who are going through that period of life where they're having children and their healthcare needs start changing, and then now they have the healthcare of their new children and their babies.
Yeah.
And then the sandwich generation. I have colleagues who are taking care of their parents
Been
too,
there.
right?
Yeah.
So healthcare is just so broad. to our society, and it has a lot of different. It looks different in a lot of different ways.
Well, it's good to see you.
Thanks
for putting a human, an MSU face on on all these things that are being talked about up here today and through this week.
Thank you for having me.
Emily, good to see you.
Thank you.
All right, we're joined today by Kurt Brower, partner at Warner Norcross and Judge LLP. Some letters there. It's good to see you.
Good morning, Chuck. Yeah, absolutely. Thanks.
Everything
Thanks
good?
For the interview. Everything is
Enjoying
fabulous.
the conference?
The conference is great. Lots of opportunity, and as you know, there's a lot of serendipity at the conference. So we're able to really move stuff forward.
Is part of it because of the relaxation of and not having cars? I mean, there's got to be something that relaxes people into cats and dogs living together.
So people, it's a concentration of business leaders and people. When you're on the island, they're approachable. You can sit down and have a conversation with somebody that might be difficult to get a hold of if they're in their office and have meetings stacked up back to back. So it really is a great opportunity to connect with the business community.
There's a lot of discussion, and I'm sure you hear it, about rising costs of healthcare and how it's influencing business. And it's not really just a trickle down, but also down to the employee level and family level, because everybody is in this.
Everybody's in it. Everybody is concerned about healthcare and making sure that when they and their family have an appropriate level of service. When you're sick, you want to get better, and you want to have the professionals and the support to do it. Yeah. And when you look, in our country, medical debt is a significant factor for a lot of people, and there are solutions. A lot of very smart people working on solutions for driving down healthcare costs.
So we've got a few things that we cannot necessarily change in Michigan at this moment. One of them is demographics, aging population, but we do know some people leave, but we're trying to always attract talent.
Right.
Is the healthcare piece and the cost piece of that a big deal for attracting new talent to Michigan?
Well, healthcare generally is a concern for attracting new talent, no matter where you are. In the United States, we have clients that are developing properties across the country and standing up, business units. Michigan, I think we're fortunate in that our healthcare costs tend to run below the national average, so we have a little bit of an advantage. But when you're trying to attract and retain employees, healthcare is a big deal, and when you look at this as a major cost for the employee, it's also a major cost for the employer, right? I think the average family policy these days is north of $25,000 a year, and that's a big cost that affects the ability for employers to give employees raises, increase their pay, and so there's really a movement afoot to continue to evaluate how we deliver healthcare, how we ensure healthcare, and how we make sure that people are healthier as we age. I mean, the good news is we, as a nation, our average age is going up. People are living longer. They're living, I think, in a lot of cases, healthier because of the healthcare that they've been able to get throughout their careers.
Well, the other part of this that I think is interesting is what people are trying to do in a unique way. Business leaders. Yesterday we had an interview. Someone who is running a business calls everybody a team member, not an employee, and said, we're trying to get to a point where we can offer free health care to everybody. Are you hearing about any other unique ways, in particular, that some business is trying to do something different that's working?
So I think, a lot of businesses are taking a leadership role in driving down costs, whether it's negotiating better prices with the healthcare providers, evaluating how they deliver services, utilizing AI to determine not just on the cost side, how do we drive down cost and get better services for less money, but how do we make sure that people are going to the right service providers. And I think AI is going to be a huge benefit in that regard, helping with data analytics to drive up quality and maybe in the same time reduce cost.
So when we look ahead into the future, improving a system is not an easy thing, because you are trying to get a lot of different people at the table who all tend to have their own parochial point of view, but yet I think when you come to this island, you start to see that people realize we're all trying to move toward the same goal.
Yeah, and one of the themes, across the different topics we're talking about at the conference is WTF, right? What's the fix? And the fix is it's not an easy fix, right? We've got an aging population. We've got, frankly, better ways of screening people and identifying diseases earlier. Cancer treatment has gotten a lot better, and in some cases it's gotten more expensive. but that reduces overall costs and improves quality of life. When you look at what employers, I mean, like we as an employer are doing, helping employees by giving them programs to help them become healthier, right? Develop healthier habits, exercise, eating better, but also getting care, getting in to see primary care physicians or others, right? Because when you look at the healthcare stack, it's not just, hey, I'm going to go to a doctor. There's a whole bunch of different levels of healthcare service providers, and fitting your healthcare needs in with the appropriate service provider helps reduce costs and helps manage what businesses spend on delivering healthcare to their employees.
And as you mentioned already, it's not just about lifespan anymore for all of us, even personally, it's about health span. You don't want to have 10 or 15 bad last years of your life, which tends to drive bills up.
Right.
So we're all trying to be healthier as we age.
Yeah, the disproportionate cost, is at in the last 10 or 15 years of life.
Yeah.
And what you're also seeing at the same time is people are working longer and taking advantage of employer-provided health care for a longer period of time. Not all employers require people to go off into the Medicare system once they age out. They're sticking with their employer-paid health care because they're familiar with it. They have doctors that they're familiar with. There's a lot less process involved. So it's, again, going back to the quality of life and how do we attract and retain good, the high-quality workers that we want. Let's make it easy. Let's make it robust. Let's make sure that we're fixing all of the problems that our employees have identified, not just what say our CFO thinks we should do from a healthcare perspective.
Yeah. What are you optimistic about up till now, and even as you leave here in the next day or two?
I think you've got. On this island, it's just a microcosm of the healthcare industry nationally and worldwide. But I think you've got a whole bunch of people who really have it in the public's best interest to deliver best-in-class, world-class healthcare, at the same time making sure that it's affordable and they continue in their business. At the end of the day, businesses still need to make profit, and rising healthcare costs tend to erode that profit margin. What do I think? I really think a couple of things. People are, I think, post-COVID. My sense is people are trying to live healthier lives. We saw during COVID a lot of people who already had preconditions were the ones that seemed to suffer the most. And so there's a trend towards healthier living. There's a trend towards healthier eating. There's a trend towards making sure that we do stuff like mental health, right? That was a huge improvement in the quality of life was when we put mental health care on par with physical health care, because that really, they're connected. And when people are happy, they work better. When they have health coverage that covers that whole range of issues, they really are better. They're better employees. They're happy. They don't have to worry about things. Bankruptcy, medical debt is a leading cause of bankruptcy and, personal bankruptcy for people. And so if you can help allay some of those fears, like, how am I going to deliver health care to my child? How am I going to make sure that when my kid is sick or my family is sick, they're taken care of? Eliminate those by providing world-class health care, world-class health insurance, is really going to be a bonus in retaining and attracting employees. And look, we're, from an economic development perspective, and that's most of what I do, it's a tough world out there. Attracting people and the better benefits that you can provide, the better opportunity you have to attract and retain those world-class employees.
Well, Kurt, it's good to see you. Thanks for dropping by.
Absolutely.
And
Appreciate the time.
I'm hoping and really looking forward to next year. We'll see each other. We just have to stay healthy.
I was going to say, let's hope.
Good to see you. Thanks. Rick Baker joins us now. He's the president and CEO of the Grand Rapids Chamber of Commerce. It is great to see you.
Yeah, great to be here.
Are you having a good time?
I'm having a great time. It's a really good conference this year.
And when you say it's a good conference, why? What does that mean?
I feel I've been making a lot of connections with people that are in attendance, and they've had some really pretty dynamic speakers as well.
Yeah.
So it's there's just a great. Well, this is probably the best weather we've had for this conference in a lot, as far as I can remember. It's beautiful up here.
It really is.
Yeah.
So we're hearing a lot of chatter this year about healthcare costs affecting everybody. You must hear this from the chamber side.
We do.
Right, about affecting businesses, but getting from business to employee to all of us at home, it affects budgets across the board.
It sure does. It sure does. And something that we hear from our employers a lot in Grand Rapids. We do an annual survey of our membership, and we get a great response. And it's been interesting to watch over the years as you compare year over year. Healthcare, health insurance, that kind of stuff was at the top of the list of concerns a few years ago. Then it sort of dropped down a little bit for a handful of years, and now it's back up to the top again. So it's interesting to watch the cycles of how that becomes, where it lands on priorities or impact on business.
So from a West Michigan perspective, when you look at affordability of healthcare, how important is that for attracting people to Grand Rapids and the environment there and retaining people as well?
Well, it's extremely important. I view healthcare as another one of those things that's an important part of our economic system.
Yeah.
But it's very complex because it's not just an economic impact for the employer or the employees, the cost part of it, but it's their health as well, and the health of the community and the ability to have access to high quality healthcare, and people are choosing where they live based on the quality and the affordability of healthcare.
Yeah, and one of our children attended Grand Valley, and my car learned how to drive there all by itself because we were visiting so much. But as you come into Grand Rapids, you realize you're surrounded by great hospital systems, right?
Yeah.
So when you start to think about all of this about healthcare costs, this is a partnership really that's broad. It's healthcare systems, it's insurance companies, it's employers all kind of coming together, and you see it here in a microcosm, don't you?
You sure do. And Grand Rapids is really, as even part of our economic development strategy, put a stake in the ground for healthcare industry with the Van Andel Research Institute, Michigan State College of Human Medicine, now BAMP, which is a new company with new technology in the healthcare arena, and then our healthcare systems, as you mentioned, and our health insurers. So it's really a big part of our economy as well.
Do you view the West Michigan approach to things that you're hearing from employers and some of the businesses you work with to be the same as what you hear statewide, or are there some unique approaches or even new ideas that you're hearing percolate?
Yeah, I think as a state, we're innovators. Okay. We've been innovators forever in Michigan. And so I think there are probably the similar conversations happening in other parts of the state that we're having in Grand Rapids, and employers are thinking about, okay, how do we maintain some of these costs or kind of, keep some of our costs under control while still being able to provide high quality access to health care for our employees. What I do think is a positive sign and I think it really kind of came to light during COVID, was how mental health became a different part of the conversation, a more open part of the conversation in the last 5 years than it maybe was in the past, and how that has effect on our physical health, and that the two are very much combined. And so I think that's a positive move as a society, actually.
So if we're looking at innovation, sometimes it takes a minute to innovate to get the pieces of clay to stick on the wall we're all trying to find. When you look forward 5 years from now, what are you hoping to see happening that could be coming out of West Michigan that could affect the whole state or even the country?
Yeah, it's interesting because I've had a lot of conversations about healthcare at this conference. I'm meeting with Michigan Hospital Association and others because I think people are searching for what's the solution. And I do sometimes wonder, when we get back to our conversation about innovation, about maybe we don't try to swallow the whole thing at once, but we try some things with smaller segments of the population. Something that I heard from one of those conversations was that 20% of all healthcare spend in Michigan is on 1% of the population. Maybe maybe there's something we can figure out there, and start smaller and in a more manageable way, because I feel like we've been trying to kind of address it all at once, and that gets to be challenging.
Well, that's interesting, because if you were to take one group of stakeholders and put them at a table and try to attack that piece at a time, and nibble away or chip away, because it may take a minute.
Yeah, for sure.
And that small group you're speaking of is what? Is that I'm just asking, is it an older population? Who is that demographic?
We didn't get into the details on what that was, but I'm from what most data we've seen in the past, it does end up being towards the latter years of your life consume the highest percentage of your healthcare costs.
So if you had a magic wand, who would you put at a table to make those discussions happen?
There's so many. Well, first I would start with the coalition of the willing, and so whoever that is. And so, but there's so many different aspects of it. But I think you should have employers at the table, healthcare providers, the insurers for sure, and then I think the patient advocate or representatives as well, and employee representatives, whatever that might be. But I think having people there with the right intentions that are looking out for how do we make improvements and for the betterment of the whole versus when groups come together and they just want to protect their piece. Then we don't get the outcomes that we're trying to. That's not innovation. That's protectionism. And so I think that would be the key was getting people there with the willing and the ones that are there for the right reasons.
Well, let's hope it works out. And innovation is certainly a thing. And I know whether it's a visit to Spring Lake to sister-in-law and brother-in-law or coming to Art Prize, there's innovation. You've got stuff that floats in the river that's kind of funny and goofy and something, and I just think this is a great place. What a great place. It's good to see you,
so
Rick.
much.
Yeah,
great to see you as well.
Thank you very much. Well, today's conversations reflect both the complexity and the importance of addressing healthcare affordability in Michigan. While perspectives vary based on role and experience, a common theme emerged. This challenge is not isolated to just one part of the system, and it cannot be solved by just any one organization alone. We heard how rising costs are influencing decisions across business, policy, care delivery, and community health. We also heard consistent recognition that progress depends on collaboration between insurers and providers and employers and policymakers and community organizations, all working in alignment rather than in silos. Across all 4 episodes of this series, one idea has remained constant. Affordability matters in Michigan and is shaped by how healthcare systems work together. From how care is delivered and paid for to how employers provide coverage and how community health is supported, each piece influences the other. What also came through clearly is that solutions are already taking shape and that they require continued partnership, shared accountability, and a willingness to work through complexity together. As we close this special series from Mackinac, the conversation doesn't end here. Instead, it reinforces a broader point. Meaningful, lasting affordability will be built through sustained collaboration across the entire system and through the voices and partnerships that continue to move it forward. We invite you to listen to this full series of episodes and learn more about what Blue Cross Blue Shield of Michigan is doing to create solutions to affordable health care online at mibluedaily.com/affordability.